Hello everyone, my name is Melinda from the European Pain Federation Ethic, and I'm here today with one of the winning projects from the Ethic and Feasibility Alliance grant on education in pain associated with osteoarthritis. Would you please introduce yourself?
Hi, my name is Adam Windak. I am a family doctor, professor, and head of Department of Family Medicine at the Jagiellonian University in Krakow, Poland.
Hi, I'm Nele Michels. I'm a GP also, and I'm a professor at the GP Center and Skills Lab at the University of Antwerp in Belgium. I'm also president of EURACT, the European Academy for GP Teachers.
Hi, it's Josep Vilaseca. I'm a GP working in Barcelona. I am also the honorary treasurer of WONCA Europe, and I am associated professor in the University of Barcelona and in the University of Vic, Central Catalonia.
Hello, my name is Herman Stoevelaar. I'm Director of Research and Development at Ismar Healthcare. I'm based in Lier, Belgium.
Hi, my name is Luc van Ruijseveld. I'm the Managing Director of EHIMS, and I also represent the non-for-profit educational society Issecam as a relations stakeholder manager.
Hi, nice to meet you. My name is Inna Pauwels. I'm a project manager at Ismar Healthcare, located in Belgium.
Wonderful, thank you so much. So to start off with, Adam, could you tell us why is this project so important for GPs?
Well, there are many reasons. Obviously, epidemiological studies shows that osteoarthritis is just second after hypertension on the top of the list of all chronic conditions treated by family doctors. All kinds of arthropathies and related to them pain conditions are very frequent reason for encounters in GP office. Patients more often visit their family doctors only for hypertension, well, baby checkups or infectious diseases. Obviously, prevalence of osteoarthritis is increasing with the age of patients. In the face of the ongoing aging of Western societies, osteoarthritis will be an increasing challenge for family doctors. Osteoarthritis, especially in the elderly, is extremely rarely the only chronic conditions that the patients suffer from. Quite often it coexists with cardiometabolic diseases like also COPD, gastrointestinal problems, other chronic conditions. So effective treatment of one condition may significantly affect the other one. Painkillers and especially non-steroid anti-inflammatory drugs are easily available also over the counter, so doctors are often confronted with difficulties in management of osteoarthritis. Well, I think it's important to notice that effective management of osteoarthritis requires also behavioral changes like weight reduction, increased physical activity, which is extremely difficult to introduce. So osteoarthritis and especially pain management related to this is a complex challenge for family doctors. We hope that ongoing educational project will help them to manage it more effectively.
Wonderful. Nele, do you have anything to add to that?
Yeah, I think we know that GPs are extremely busy and it's not always easy to stay on top of all the latest updates. And by experience and by literature, we know that a practical and case-based approach is very much appreciated and also very effective. We have already worked with the pinpoint case approach from Issecam and EHIMS and ISMAR. And so in the past, and also now with the ongoing project on COVID-19, and we really find it very useful, an attractive way of learning. So we have good earlier experiences with it.
Wonderful. Now, Luc and Herman, can you tell us briefly a little bit more about the pinpoint case approach?
Absolutely, with pleasure. Well, the pinpoint case program is a independent CME program. It started in 2018. And it consists, it's a combination of a platform, a website, containing a lot of cases, and this is an IACME accredited platform, meaning that everything coming on the platform is automatically accredited due to the robustness of the methodology that we are using, and Herman will tell you more about that. The nice thing is also that it is disease independent, meaning that we can cover all the diseases which would need a case-based approach in terms of education. And we started in urology, in GU oncology, and then we moved also to breast cancer, to COVID-19 related matters. And now we absolutely believe that pain due to osteoarthritis will gain also from this format, this educational method. But Herman will tell you more about how it actually works.
Thank you. The principal idea, the philosophy behind the Pinpoint case platform is that we want to translate the best available evidence to decisions in everyday clinical practice. And we want to do that in a way that it's concise and efficient, and that it stimulates people to ask, what would I do in this specific situation? And it means that good cases are extremely important. Should be clear, relevant, recognizable. This could be my patient. And to build good cases, we have a stepwise and a very structured approach. We always start with a needs assessment to identify the knowledge gaps that should be addressed. And for this program, for example, we've done a survey amongst representatives of Europe and WONCA, the organizations for family physicians and teachers in family medicine in Europe. And together with a working group consisting of people from all relevant disciplines, we determine the most important topics that need to be addressed. And then the individual members of the working group start working on making cases. And these cases are circulated and eventually the individual members of the working group are asked to individually assess the appropriateness of all the clinical options that are included on a 9-point scale. And based on the median panel score and the extent of agreement, each of these options can be categorized as being appropriate, inappropriate, or equivocal. And in our program, the user, the learner, is firstly invited to read the case and to give his own opinion about what is the best option for this patient. And thereafter he gets feedback in the form of the opinions of his peers who also answered the same case. That's the first thing. Secondly, the recommendations of the international working group. And finally, a very concise summary of the literature and the guidelines that apply to specifically that case. And Luc, maybe you can tell a little bit more about the dissemination of these cases.
With pleasure, Herman. I told you before that the platform, the accredited platform, is one part. The second part is that we work with a weekly case email program. So every week we send out a case to our community, and in GU Oncology, for instance, I'm talking about already 4,000 active users worldwide, but with a strong focus on Europe. They get this case. It's a brief case. They have some options where they can choose from, and by choosing one of the options, they are immediately transferred to the platform. So it's kind of an onboarding program, and that makes it, of course, very, I would say, activating. And people don't need a lot of time to do this. If they have a minute, 2 minutes, they can do such a case. If they have more time, they can do a couple of cases on the platform more. So we really like this way of short learning moments that have a very low threshold in activating people to learn. So as I said before, we have more than 4,000 users. We have done more than 70,000 cases already by these users. We have more than 2,000 credits which are already offered. So I think we can really talk of a successful program. And we are currently also running a large innovation program allowing and promoting individualized learning via quick scan dashboard and an individualized learning track. So that will normally make the program even stronger than it already was.
Wonderful. Now, Joseph and Ina, can you tell us what has been done so far in this project?
Well, we have done a survey, as we mentioned previously, in order to assess what are the specific needs of general practitioners regarding to osteoarthritis. As it is mentioned before, osteoarthritis is part of our day-to-day life. It's highly prevalent, very frequent, so it is unlikely that a doctor have no idea on osteoarthritis. Instead, they are very experienced. So we want to focus in the specific gaps in knowledge regarding to osteoarthritis. That's why we circulated a survey among our members, Wonka Europe, URAC, and colleagues and friends, family doctors all across Europe. We had a high number of responses, and then we could focus specifically in what are the specific needs regarding to osteoarthritis.
As Joseph mentioned, we have taken the first steps, and from that survey, we are deciding which 4 topics will be the most important to address. There were also people who applied for the working group, so GPs who will make the cases. And I think we had almost 30 applicants in total. So we're now selecting our final 12 members for the working group. And in addition to the 12 GPs in the working group, we will also select 3 specialists, someone with experience in pain, orthopedics and rheumatology, because we think it will be very interesting to have a broad look. And in the next months, we will have a virtual meeting with the full working group and the specialists to get started on developing the cases. This will be done over the summer holidays. And then in autumn, we will do validation and review. So we hope to have everything up and running and live by end of year.
That's amazing. Now, talking about the end of the year in the future, Nina, can you tell me what are your expectations from this project? What do you hope to achieve?
Well, first of all, as a GP and as the president of URAC, I'm very happy to contribute to this significant addition of CME for GPs. I'm sure we will develop a very to the point and attractive way of communicating this new knowledge. And we already talked about that. It has already proven its effectiveness in other disease areas, for other target groups. And in this case, or in this project, we can use the huge network of Wonka and of URAC. So this project will also have a wide reach. The challenge will be to make it country and language specific to enlarge the effectiveness, but I'm sure we will make that.
Wonderful. Thank you so much. Is there anything else you would like to add?
No, I think we are very excited to do this with a focus on the role of the general practitioner of family medicine. And we would love to have the same approach also targeting the specialists. So this is something that maybe we can definitely discuss with ethics so that we have a really holistic approach with this program. But very excited.
Wonderful. Well, thank you so much for taking the time, and I wish you all the best with this amazing project.
Thank you.
Thank you.